Well, the Northwest government has turned to a doctor and influencer as it tries to encourage the youth in the province to get vaccinated for COVID-19. Dr. Thato Mosehle was named as the ambassador for the COVID-19 vaccination rollout campaign during a briefing by the provincial government officials recently. Let's speak about this with Acting Premier of the Northwest, Motlalepula Rosho, who's joining us live now. Ma'am, a very good afternoon to you. Thank you for your time and being on Newsfeed PM. Let's begin with why you've chosen to enlist the help of an influencer to drive the COVID-19 vaccination message.
Good afternoon, and let me greet the viewers at home. I think as the Northwest Province, we realized that we need to massify our numbers in terms of registering for vaccination, and also to ensure that people get fast vaccinated. And as you know, that the Deputy Minister did indicate, the Deputy Minister Zlomo, the Minister for Health, he did indicate that the provinces that need to improve in terms of their numbers to be able to meet their targets, it is the Northwest, it is in Mpumalanga, as well as Gauteng. So as Northwest, we develop a strategy that let's identify influencers, and then we launched, we then invited Dr. Mosehle, our first runner-up for the first princess from South Africa, and she's also from Poland, and she's the second runner-up from Poland. So then, as a medical practitioner, she must lead a campaign to target young people to ensure that we are able to ramp up our numbers. And even yesterday, we launched again with the vaccination rollout in Pujanala with our bikers. So our strategy is that let's identify influencers within the province who actually resonate also with young people, and Dr. Mosehle will be our ambassador, but Dr. Mosehle is going to invite more of our influencers in the province. We have our artists, we have DJs, we are still going to engage that. We also have besides the bikers, we are having Pujanala women cyclists. We're also going to engage them. So we want to roll out this, massify it across the province in villages where we do door-to-doors, as we do with our bikers, as we move with Dr. Mosehle, to make sure that we start to attract more people to come and vaccinate across the province through our pop-up sites.
The issue with the use of influencers, shall we say, especially in advertising campaigns, is you find that there is, for example, if they're sticking to social media, a lot of engagement with their posts and what they share, but it doesn't always translate to the bottom line. I'm wondering why you, as the Northwest government, think influencers would be more effective than spreading COVID-19 messages through perhaps community television, community radio, community newspapers.
We will be using our social media platforms to intensify our mobilization and outreach program. But of course, we thought that also just to triple our efforts, people like Dr. Mosehle, who's a medical practitioner, she'll be able to be one of our strategic people. Hence, we say that she'll be our ambassador to ensure that we start to influence, is able to publicize, is able to communicate messages through to young people, because she also have her own blog where she'll communicate with young people, but also that she will be followed on Facebook, she will be followed on Twitter, she'll engage in whatever platforms with young people to make sure that they're able to register for vaccination and finally vaccinate.
I suppose the other issue with that is when you engage with young people who are online, they already have so much access to COVID-19 information, and perhaps the focus that's needed, as some have said, is getting people in the further flung parts of the country to hear more about COVID-19 vaccination, to hear more about concerns that people have about the vaccines themselves, the side effects, and the precautionary measures. So is this the best way, again, to do it?
I think that while we are doing that mobilization, we'll be, as members of the Command Council across the province, we have 4 districts. We'll be going through with, as members of the Command Council in various districts, to communicate the message of demystify whatever message that is there about to the vaccination, and also with health practitioners, which will be in all districts. They'll be able to assist that. And Dr. Mosehle will come handy, actually, as a medical practitioner, to be able to give that clarity, to be able to engage in various platforms, even if villages, if we are in a particular village, let's say for example in Dr. Mumpati, we can be able to have a platform with Dr. Mosehle as a medical practitioner, but also as an influencer, as our beauty pigeon. She will be able to reach out to our people so that we are issues of misinformation are clarified. We are able to guarantee and reassure people the importance of making sure they vaccinate. And she's also committed in promotion of total wellness as a medical practitioner. So we'll run that program together with her.
Would that not still be effective then, just using the regular community healthcare workers who are already in place?
Yes, I think yesterday we've made actually we are now at 20% in terms of our vaccination mark. So I think there's great progress, and with our launch with our bikers yesterday, working together with our community health workers, we will be engaging with the House of Traditional Leaders, our tribal authorities in our villages, our pastoral services, our religious fraternal organizations. They will form part of the stakeholders that we will be engaging with. Even various MECs from various departments, they will run their own specific drive in terms of their responsibilities and their mandates to make sure that we continuously communicate that. I think one is quite happy with the work that is being done so far, especially with yesterday's launch with the bikers and with the launch of Dr. Mosehle as an ambassador on Friday.
How much is this campaign going to cost you as the Northwest government?
We're still working on the numbers so far. We will finalize that between Provincial Treasury and Department of Health. I think we'll be able to communicate that once they conclude. That may probably by next week they would have done that. But also we must know that also we are working with communicators. So they will also have to conclude their budget that they will have to table before Command Council.
There are those who will say to you, listening to this conversation, that we've just been dealing politically with the crisis at municipalities, for example, in the Northwest, where there's a desperate need to direct funds into the delivery of services, and that spending that money on influencers, at least for COVID-19, may not be the best use of these funds. What would you say to that?
To be quite honest with you, we admit that there are challenges in our municipalities. We must note the fact that with our municipalities, we do have municipalities that are in financial crisis, and government actually, as a collective of EBSCO, we have resolved on the intervention support that will be provided in terms of our Section 154. So redirecting funds is not going to be like, because you need to prioritize preventative measures. We need to prioritize to ensure that we reach out to our people to be able to vaccinate, to convince people who are not ready to vaccinate and ensure that they vaccinate. But with our municipalities, with the challenges that are there is a process that is being followed through between Department of COGTA, led by MEC for COGTA, MEC Lena, and the Provincial Treasury, whereby they are working together in making sure that challenges of municipalities, that they are receiving a proper attention. So there is a systematic process.
Pardon me for jumping in. So you would understand then people who say this is perhaps a waste of money, given that you already have community healthcare workers, the department has other communication systems that could be used without spending extra money, for example, on an influencer and bikers.
It's not about the waste of money. I think part of our public relations program within various departments, we have communication officers. They work as a collective. So we contribute as a collective together in making sure that we are able to prioritize the work that needs to be done through a Department of Health and support the program of reaching out to our people to make sure that our people vaccinate. So I don't think that it will be a waste of money. I think we are trying to intensify our program. We are making sure that we are able to popularize our program in terms of vaccination, and we are able to ensure that our people finally they come and accept the reality of COVID-19 and the importance of making sure that they vaccinate.
All right. I want to ask you, ma'am, before we run out of time, about people who were reading online about people from Botswana crossing into the Northwest for COVID-19 vaccinations. How much is that happening to your knowledge?
I'm not to my knowledge that I don't think we have much influx, because the report that we have, I think it's about 3 months ago, we didn't have much challenges in terms of people coming into our province and doing maybe vaccinating, but I think it is well managed. I would not be outrightly having the percentage in terms of the numbers that people are coming, but the influx is not as bad as one would think.
Thank you very much for speaking to us, ma'am, about the situation in the Northwest. That is the acting Premier, Motlalepula Rosho, updating us on the use of influencers as the Northwest tries to take the COVID-19 message to young people. The government believes it is not a waste of money to spend on that project at a time when the Northwest is already facing so many other challenges that require funds. Thank you very much for your time, acting Premier.